more and more you'll see in the mainstream literature, even the alternative literature, that most conditions, chronic conditions, and many acute conditions are inflammatory in nature. And inflammation is our body's response to an insult. It's an attempt to protect you. And we've talked about this, and if you've been to more than one class, you'll probably recognize that the basic foundation of what we're trying to encourage you to accomplish is pretty much the same whether we're talking about arthritis or diabetes or cancer or heart disease. We've got to control inflammation. And this is, on this front page is a list of things that are now considered autoimmune in nature. And that list is growing almost exponentially because as we understand the body's response to a variety of insults, as we become more skilled in dealing with what is really going on cellular and even subcellular levels, we see most chronic disease have things in common. I was recently reading a book. It's not really a book. What it is a compilation of articles that were written by a dentist 100 years ago. And you think, how was that relevant today? Was he bleeding people? Or was he, you've noticed how leeches are coming back into vogue now? If you have something going on, they might put a leech on you. And this was a dentist. He's a genius. He also wrote this book called Nutrition and Physical Degeneration. Weston Price is his name. And it should be required reading for everybody, because it would make everybody so much healthier if we understand those principles. I have a son that went through osteopathy school and essentially medical school. I had another son that went through dental school, and neither one of them are even aware of these people. I've contacted 3 or 4 dentists. We've got a situation in my family where some root canals need to be removed, and at least in my opinion. But doctors, if the tooth is not obviously infected, if the tooth is not painful, you can't, quote, ethically, unquote, remove the tooth. Well, Dr. Price, 100 years ago, found it just fascinating. He had it's much more complicated, and you can't get the book anymore unless you get it through me, because I'm getting it reprinted. He had a patient with arthritis that had a root canal. And after he pulled the root canal tooth, the arthritis went away. And this wasn't just one case, and this was crippling arthritis. On one of the cases, the mother had 4 children that were taken away from her because she couldn't care for them. Her husband had to dress and feed her. The tooth came out, and within 3 or 4 months, she was well. And he did this over and over again. And then what the fascinating part is, he took that tooth and cultured it, and took the material from the culture, injected it into rabbits, and gave them arthritis. And he did that. Then he took the material from that rabbit and injected it into another rabbit, and that rabbit got arthritis. Fascinating book. I won't get too far off of that. It's just exciting. But one of the things Dr. Price said is that when you discover a new truth, it's like acquiring a new sense. You know, what happens when someone that couldn't hear gets to hear, or couldn't see and gets to see? The whole new world is opened up into them. And this book and that truth that you cannot sterilize root canals opens up a whole new world as to perhaps the cause of many chronic conditions. And if you don't have that truth, you go through life like many of us do. And this Dr. Price was humble enough to say, you know, I'm embarrassed about what I used to do 20 years ago as a dentist. I wasn't ready to practice dentistry 30 years ago or 20 years ago or even 10 years ago. I can make your mouth look beautiful, but I may be killing you. Anyway, he raised a lot of opposition, because 100 years later there's still opposition to this idea. But keep that in mind. When you get a new idea, it just opens a whole new vista. And until you're going to find opposition, because most people still lack that sense that truth has given you. See? What happened when a few people got the idea that the world is round? Ooh, that opened up a whole new world. But they usually got burned at the stake or killed in some other way. There's a handout right there, if you guys like to share one. Okay. So keep an open mind, and because you're gonna start seeing things as you accept some of these ideas. You're gonna see things from a totally different way. But don't expect other people to agree with you. Yeah. Okay. So what's an autoimmune? What is your immune system? How does your immune system work? Okay, well let's you get a few basics and the rest of it would be easier to understand. Okay, your immune system is the part of you that tries to protect you from outside influences or inside influences that go astray. So in a real simple way, before you're even born, your immune cells circulate throughout your body and come to know who you are. And so they recognize you. It's like when you move into a new neighborhood, it takes you a while to get familiar with the other people, but after you've been there a year or two, you recognize cars as they go down the street. You recognize people that walk. You recognize your neighbor's dogs. You recognize the sounds of your neighborhood. So in the middle of the night, you wake up in the middle of the night, you hear a noise, and you say to yourself, oh, that is the refrigerator going on, or the furnace going on, or the my dog jumping off the bed. And so you go back to sleep. But if the noise is a little bit different, then you're wide awake. I have a dog, and if I walk up my driveway at night, and the dog sees me, I might hear one bark, and then I just keep coming, then the dog stops barking. But if I put a hat on, the dog barks until I either say something to her or I take off the hat. Because there's something about me without the hat that she recognizes. And that's where the dog's been around me long enough that she recognizes the way I walk. If I walk through the house at night, she doesn't jump up. Because she recognizes, they are so sensitive. They recognize funny little things. One night we were up in my bedroom, which is clear on the opposite end of the house at the back porch. All of a sudden the dog went crazy. And we didn't hear anything or see anything. Finally I went down looked around the house, went out, turned on the back porch light, and there were some raccoons on the back porch. How in the world did she hear them? Anyway, your immune system's even better than that. Okay, so your immune system recognizes who you are. And so we'll just put all of you, you're in the green here. That is you. And so when your immune system comes in contact with you, a healthy immune system will ignore you. It just bounce off. And that's the way it should be. But if you get a bacteria or a virus, and your immune system doesn't really recognize those things, then when your immune system sees those, then it reacts. And it makes, now this is very simplified, it makes antibodies. And the antibodies bind to these things and inactivate them so they can't damage you. So we don't want our immune system reacting to your skin or to your hair or to your stomach or any of those things. And that's, if you look at this list, you see every part of you is represented here some way. and this list, like I said, is probably incomplete. It's your skin, it's your blood vessels, it's your joints, it's your lungs, it's your brain, it's your gallbladder, it's your muscles, it's your intestinal tract, it's your pancreas. It just goes on and on. So something, when the immune system is reacting, something has happened in you that has changed something. Either your immune system's forgotten who you are, or you have changed in some way. So let's explore a little bit some of the things that might change us. Now, if you look at a book like this, The Autoimmune Epidemic, and I've written it down there. People should really read this book because it gives you an idea how easy it is in this day and age, because we're exposing ourselves to things that people have never in the history of the world been exposed to. How long have we been drinking out of plastic bottles? And 100 years ago, how many different kinds of makeup did people have? Or how many different hair colors could you get? Or lipstick? Or air fresheners? What they use for air freshener, I don't know, you get some sort of leaf or bay leaf or something and wave it around. But all these things are chemicals. My daughter, the Dollar Tree is a great place because people get good deals at the Dollar Tree. But you can also get a bunch of junk. My daughter came home the other night, and I've got to learn to control her, with a fluoride mouthwash. She thought it was a breath freshener. And now she's rinsing her mouth out with fluoride. I go crazy. So sometimes you got to learn to ignore, but I can't ignore that. So and see if you can find in most grocery stores, see if you can find gum that isn't sweetened with aspartame. Now you can, there's some. What is it? Some have xylitol in it, and that's good, but not the common brands. Orbit, does Orbit? I won't worry about it. But they have these, and these are chemicals. These affect your brain. They damage, or at least we know they damage your brain cells. Try and find any sort of packaged food that doesn't have MSG in it. MSG is another brain changer, body changer. So we have one, and like I say over and over, have either of you had amalgam of the silver filling?
I haven't had any of those.
You pardon?
I haven't had any silver.
Have you? See, a few people in that generation, those are my granddaughters, and a few people in that generation are avoiding it, a few. But the dentists are still putting it in the mouth. And I'm sure none of you have never had a silver amalgam. And there's a recent post. How many of you like chocolate? I do. A recent post pointing out that the majority of chocolates have lead and cadmium in them. You see, they don't advertise that, do they? Warning, may contain lead and cadmium. They don't have those. But they're there, and these are toxins. They damage your cells. Okay, so we've got to be careful. Infections. Now, if you're a nurse, you got a good start in life. If you've taken antibiotics, you've damaged that. If you have taken any drugs, you damage your intestinal tract. And when you damage your intestinal tract, that's where 80% of your immune system is. And there's not much emphasis in medical education about rehabilitating your immune system with things like acidophilus and kraut and probiotics and various things like that. When we eat sugar, we damage our immune system by damaging what's growing in our intestinal tract. Okay, food additives and preservative. Isn't it nice to move into a home with new carpet, or just been painted, or get a new car? It has that new smell that's killing us slowly. All these things, exhaust fumes, barbecue, chloride, fluoride, and bromide, cooking in styrofoam. Microwaves. If you've got a microwave, get rid of it. Unless you're selling your home and it might add a little value of it.
Can't I warm my plate up with it?
Why?
Well, I'll make my plate
Turn the
warm
hot
so much.
water on it. If you have a totally inert plate, you could, but I don't know. Even water. Someone did an experiment. They heated water in a microwave and then used it to feed animals, and they all die.
Really?
Yeah. Nothing grows. You water your plants with microwave water, they don't thrive at all. So a microwave is purely convenience. And unless you're really a busy, important person, you probably, how many of you are real busy and important? No, okay, well, at least one. Okay.
One.
Okay. Okay, and your lawn isn't more important than your health. Stop using junk on your lawn. It's much better to have dandelions than it is to have, autoimmune thyroiditis or colitis or arthritis. And unfortunately, once you get those things, stopping the junk on your lawn probably won't cure you. Okay, plastics. It just goes on and on. And if you know anybody that has new babies, really try and convince them to not feed them out of a plastic bottle. If they're going to nurse them, then put them on glass bottles. I don't know how they do it these days. They probably put baby formulas in the microwave to warm it up. Is that what they do? Is that what you do with your baby, America?
No, but what I do.
Yeah, I know. I mean, what's that doing to a baby?
Pacifiers too, aren't they plastic?
Pardon?
Aren't pacifiers plastic? The pacifiers?
Yeah. No, in the old days they'd put a bacon rind on this, tie a string around it, and tie the string to your waist so in case your wrist, in case you swallow it, they can pull it back out. It's probably better than these pacifiers that kids just live with. I don't know. When you grew up, were there pacifiers? No. And did babies cry continuously? No. I don't anyway. Probably because they're drinking that microwave formula. I don't know. It's hard. Okay, these chemicals are what they call xenoestrogens, XENO. That means they're very similar to hormones, and your body sometimes recognizes them as hormone-like, and so it blocks the action of healthy hormones. It's very hard on your health, all these chemicals. Now, one of the things these chemicals do and these heavy metals do, they change the structure of things that are normal. Okay? Now, if these little pieces look sort of like this, then what's going to happen when this immune system, when it grew up, learned what normal things were? What's going to happen? Oh, come on,
It's going to lose its intelligence.
It'll be confused, won't it? And for your own protection, it's going to make an antibody to them. Now, it's difficult to predict where you can have two people with the same, apparently the same type of allergic reaction or same reaction to the same thing, but it can affect totally different places in the body. You have a milk allergy that gives one kid eczema, and the same a milk allergy in another child gives him diarrhea or asthma. So we can't predict. But the common denominator is that it's an allergic reaction. So if you treat it like that, you can treat a lot of different things the same way. So, when your immune system does this, it's me with a hat on. The dog would come running up to me barking. And so your immune system, and unfortunately, it's very frustrating because traditionally these are treated with drugs. I just had a phone call from a lady some time ago. She had severe arthritis. Well, the anti-inflammatory medications, which are designed to suppress your own adrenal response, they weren't working anymore. So now she was getting chemotherapy. They're trying to kill part of her immune system. But it will also affect any rapidly growing tissue, which your gut is a big part of that. So here, it's further damaging the immune system. But people get desperate, and so people will accept chemotherapy. I guess it's because it's easier than going off gluten. I don't know. Okay, so the bottom line out of this first part I wanted to talk about is that you can't avoid the exposure to these things. If you were exposed previously to antibiotics, what's the big mantra now about kids and washing your hands and antibacterial soaps and all these things? Oh, we've overdone it. Now the biggest fear is we've got superbugs out there. So when you get a sore throat or a earache, the antibiotics don't work anymore because you killed off the vulnerable the bugs and you left the resistant ones, and they multiply crazy. I personally think you go to the grocery store, you use a wipe. I think it's really probably better for you to put your hand on the thing and get exposed. In the old days, you all grew up with this. Some of the neighborhood got chicken pox or measles, and you'd send your children over there. Please get sick. It's a lot easier to take care of you when you're sick in 4 than it is when you're sick in 40. But nowadays, people don't get these, so now they think they're going to vaccinate people into health. It's just a big lie. You read how they're going to vaccinate 22,000 kids at the university with a substance that does not work? That's really, my family is really a hullabaloo about vaccine, because one part of the family, we've got a relative that's a doctor, and his children grew up with the vaccination routine. Now my kids grew up without the vaccination routine, and so there's a lot of pretty hot and heavy. One guy says we should all be on some deserted island someplace. You're killing us off. These hippies, that's us. You hippies are going to kill us all. Anyway, very interesting. Okay, here's a few references, and you don't have to read them all, but you really should get some idea of what you're dealing with. And if we look at this back page, or this, probably wear it out, that picture in the back, that's your adrenal gland, and that is what should be protecting you from excessive inflammation that you might get if you have some sort of allergic reaction. But if your production of the anti-inflammatory hormones that your body normally uses to control things that come along on a regular basis, if it's used up with some other form of stress and inflammation, you won't have enough to control your exposure to a grass pollen or a chemical in your home or a bit of a food allergy. Here's the other, I think we better cover this quickly. Your intestinal tract is just huge. And these are what they call villi. They're little, the lining of your intestine just has millions of these. And on each one of these little things, you have these little hair-like projections, which are also, if we magnified that, would see they're just like this too, and each one of those has a little blood vessel going up into it. The purpose of all this is to increase the surface area of your intestine. They say if you spread out your intestine and flattened all these things out, you could probably cover a football field. So it's hard to get that all into one little tummy, and so it's concentrated. Now, when you eat, now here's the other thing that we have trouble with. We don't digest our food. Now, if you eat a piece of food that starts out in your mouth like this, and it should end up like this, and this gets absorbed, your body recognizes that as food. And so you don't get an antibody response. If a partially digested food particle gets absorbed, and it will because all of us have some inflammation there, so it's leaking, then your body reacts to that. So that's another way we use up our adrenal gland energy, which diminishes our ability to control little local areas of inflammation. And if we don't control the local little inflammation, it progresses to big inflammation, which we call arthritis or asthma or colitis or diabetes or cancer or arthritis, any of those things. And so we all have some degree of autoimmune problems because none of us have really been perfectly cared for. Okay, so this is, you can just look at this and get some idea of what you might do to improve your health. Get off medication if you can. Control your emotions. Find ways to use emotional freedom technique or tap or learn to meditate. Minimize your exposure to controllable things like dust and pollen. Get your hormones in balance. Minimize your exposure to environmental chemicals. Get out of a stressful lifestyle. Minimize your, I'm going to embarrass my granddaughters. They have quit eating sugar. Isn't that amazing?
Yeah.
I mean,
good.
that, a few other people in the family are, most of us haven't. But see, that's a huge part of getting rid of stress. And I don't know how to, sell what they've been able to do. They ought to somehow package it, and it'd be a big seller. Okay, if you're constipated, or anyway, all these things reduce. Well, it's like getting on a budget or controlling your spending, because you'll have more money to do other things you might want to. What are cigarettes today now? It's $5 a pack. If you're a 2-pack a day habit, that we'll just say $10 a day. That's $3,000 a year. You could say. That's the same way with health. If your adrenal gland and your hormones are functioning properly, you're going to live longer. You're going to be able to avoid going to doctors. Okay, back to okay, we go to this prevention and treatment options. Well, we talked about the traditional method. You give anti-inflammatory, you give Benadryl, things like that. But then, now I saw just recently that if you take Benadryl or any of these other, what they call anticholinergic medications, your risk of dying goes up. I mean, it's a significant percentage. Where we used to think Benadryl and things like that are pretty benign. Take one at night before you go to bed, you sleep better, that sort of thing. The longer you take it, the greater your risk. And then we get to these immune suppressors and actually chemotherapy. So it's like, if you have a car that's making a funny noise, you don't just put earmuffs on. If your tires wear out every 5,000 miles, you don't just keep buying new tires, you hope. You try and figure out why. But when you do these things, you're just trying to suppress the symptoms. And that's dangerous to you. Okay, so what do we do if we've got a severe problem? Well, you can get off the foods that are most likely to be offensive. And these are the foods most people eat a lot of. These are the popular foods. 65% of most Americans 65% of the calories from most Americans comes from a particular food category. What do you think it is?
Wheat.
Grain. That's right. We're grain addicts. And in part because, we've talked about this, but when the bacteria in your gut are abnormal, those bacteria convert grain into morphine-like chemicals, which then hit your brain. So, Kurt, how do you know if you've got a food allergy? What's the quickest way?
Quit eating anything until you get over it.
Well, remember, we're gonna go 24 hours without eating. Now, if you can do that and stay pretty much symptom-free, hunger I don't consider a symptom. If you can go 24 hours without eating and still feel pretty good, pretty normal, foods probably aren't a big problem. Still could be, but the chances are much less. So something you probably, and if you go without eating once a month, you're going to live longer. I think they figure 10% if you do it once a month. Okay, eat wholesome foods. Better eating habits. Now, how are we going to overcome this problem when we don't break the food down completely? How are we going to overcome that? We're going to have better eating habits. You're going to eat slowly. You're going to chew your food better. You're going to drink less with your meals. And for most of us in here, we're going to take something to help us digest the food, because just like I wear eyeglasses, I'm probably going to be healthier and have better digestion if I use pancreatic enzymes and hydrochloric acid and pepsin and things like that. That'll help me break the food down. It'll be less reactive in the gut. My adrenal gland will have a little more energy. I'll have more natural cortisone available. I'll have less inflammation. So my pancreatic cancer will stay under control. Or maybe it's my prostate cancer. I can't remember which one I have. But see, cancer is inflammation. Why do you think turmeric helps cancer? Why do you think turmeric helps depression? What's one of the features of turmeric? Anti-inflammatory. So what does that tell us about even depression? Your brain's inflamed. Yeah. I was looking on, we have a little bottle of turmeric on our eating area. And it's been there for a while. And if you have one, you'll see the size of the bottle get coated, so you can't. So I opened it the other day, and we've had it probably there for 3 months, and it's half gone. See, now maybe that's not going to cure anything, but it might prevent something. It's really pretty good. So any of you others use turmeric regularly? Yeah, it's pretty good, isn't it? Yeah, it kind of spices things up. Yeah, yes, sure.
Do you think depression is nutritional?
It sure could be.
It's a component of it.
See, what we've been told. My daughter called me the other day and said, what do you think, Viagra and Cialis, the big sellers, but then, equal rights amendments say, oh, gee, women should have something to stimulate their sexual appetite. And so guess what? They've got one. And, women should have the same rights as men, so as we get older, but now they're selling it to young women. You have a baby, sex doesn't sound very exciting, and so, well, give me a pill so I can change. So instead of addressing the issues, hormone balance, thyroid issues, iodine, all these things, they're going to give them a chemical. That's pharmaceuticals' way of responding to a demand. Yes.
I work on a mom-baby unit at Sacred Heart. This is for sure at least 50% have a history of these young moms have a history of anxiety and depression.
Yeah.
And migraines.
And unfortunately, a lot of these young moms aren't really young. They're 30 and 35 and maybe their first baby. Yeah, but see, instead of anxiety and depression, so instead of looking at their diet and their vitamin intake, they look for a chemical to fix it. So it's much easier to call you depressed when you're really a vitamin B3 deficient.
Well, a fourth of them are on Zoloft or
Yeah, it's just quick and easy. And you go to the doctor and he's only got 15 minutes or less to fix you. So it's a vicious cycle. I don't know what the solution is. Good for people to educate themselves and do more about taking care of themselves.
They're usually overweight too.
Pardon?
They're usually overweight too.
Yeah, it's just a whole vicious cycle. I wouldn't be surprised if one of the side effects for those medications is obesity. Yeah. Okay, so we clean up our diet, improve our eating habits, and things will get better. If we do nothing else, things will get better. Now, there's certain supplements that have been found to help all sorts of these problems. Unfortunately, for most people, you can't be 40 or 50 years old and have had arthritis for 20 years, and then all of a sudden say, gee, I'm going to take vitamin D and that probably will fix me. It'll probably make you better and slow down the progression of your condition. But you've got, if you've had this condition for a while, you've got to do a lot. It's not easy. But on the other hand, it's like an early diabetic. It's not pleasant to make the changes necessary to stop diabetes. Unfortunately, we can't let you experience the complications of diabetes. Let you experience the complications of having your leg cut off, or going blind, or being dialyzed, which are all common complications of, advanced diabetes. But people all have this idea it's not going to happen to me. So we've got to be smarter than that. We put our seatbelt on. Anyway, but all of these things have been shown to, but see, here's the thing. When we start using sauerkraut or vitamin D or turmeric or whatever it is, you've got to take it in adequate amounts. Remember Linus Pauling. What's one of the things he's famous for?
Vitamin C.
Well, that's one of the things. That's right. Yeah, adequate quantities. Anybody here take 10,000 milligrams of vitamin C a day? You probably aren't taking it. Anybody at bowel saturation for vitamin C? See, most of us take it and we think that's enough. So how are you supposed to be figuring out what you need besides bowel? How much turmeric do you need? You've got to learn to dowse. You just got to learn to use your pendulum. Hocus pocus. There's no other way you're going to figure that out. But we've got to take enough. Now they say for cancer you need 500 milligrams of turmeric a day, or 2 or 3 times a day, maybe that much for depression. So I've got a little scale at home that measures in milligrams, and 500 milligrams of turmeric from Safeway is about 1/4 teaspoon. So I would guess at a meal, a typical meal, I might use 1/8 teaspoon once or twice a day. But see, I'm trying to prevent. I'm not trying to treat something. But you can buy capsules. You can buy tablets of turmeric, which is much easier to deal with than weighing in a scale and fiddling around. You've got to take enough. So on these things, and even on the hydrochloric acid, douse it. Get an idea about how much you need. You might be a 1 pill a day. You might be a 3 pill. Everybody's going to be a little bit different. Now, I'd say if you have a serious condition. Now, I talked earlier about root canals. Now, if you're feeling good and you don't have heart problems and you don't have arthritis and you don't have colitis and you have a root canal, you may be one of these. Dr. Price found that there are people that can live with root canals and not have any trouble. But that's going to depend, in my opinion, he didn't talk about this, that's going to depend upon what else you're dealing with in your life. It's going to depend upon who your mother was. It's going to depend upon, did she nurse you? How many times you take antibiotics? All these are going to come into the role, whether or not that tooth is going to give you arthritis or diabetes or whatever. But if you're feeling good and your blood pressure, you aren't on medication and stuff, then I probably wouldn't recommend you go have your tooth pulled. But if you're dealing with something serious, cancer, one of the other things Dr. Price did, he had a guy who had an inflamed eye, retinitis, iritis, he didn't know what, and the guy was going blind, and the doctors really couldn't treat it. They pulled the tooth, and he got well. And this has been going on for years. And so they took that tooth, it was in his left eye. So they took that tooth, this is, in my opinion, this is almost unbelievable. What's even worse that it's been 100 years and nothing's been done with it. But they took that tooth and ground it up and cultured it, and then they filtered it. And it was somewhat primitive by our standard, but they put this through the filters that most bacteria could not go through. And then they injected that filtrate into a rabbit, and the rabbit got the same problem in the same eye. And then he took that rabbit eye and cultured it and did it to another generation of rabbits. He did it for 3 generations. They all got the same infection in the same eye. To me, that's mind-boggling. Anyway, now you have a truth that you got a new sense, right? Okay. Okay. So back to what do we do? If there's a history of a lot of metal in your mouth and you've got a chronic one, at least get a hair analysis to see if that might be a problem. Because if you do have lead or mercury or cadmium or that's a huge stress on your body that your body can't, it's taking a lot of your body's energy to deal with that. And there's a lot you can do to detoxify yourself. And it's not all unpleasant. You can get one of those saunas and sit in the sauna. I mean, that's kind of nice. Yeah.
I just want to acknowledge that lead in the hair is a natural way that the body is releasing the toxin out of the
Well,
body.
it's one way it is. Yeah. You should not use, you got to quit using Grecian formula. I guess you aren't. You're still pretty great.
Yeah.
Yeah. There's lots of ways. And one way, your body does excrete lead through your hair. And it's easier than doing a bone biopsy. And so it's not 100% accurate, but it's relatively inexpensive, easy to do, and so it is a way. So if you had a bad history of dental work, I grew up in the Willamette Valley. When I was in the Navy, I went to the dentist on the aircraft carrier, and he looked in my mouth, and I think we were in Hawaii or Japan or something, and he said, "Oh, you're from the Willamette Valley." That's how famous the Willamette Valley is for soft water and bad teeth. But if you've had that problem, then get it checked out. There's other ways of doing it. You can do it. Well, if you have a problem, there's whole books written about detoxifying your body. Detox or Die is a great book. But find out if you have a problem. Yeah, there we go. And like I said, sauna is another way to get rid of chemicals. Saunas don't get rid of heavy metals, but all these chemicals we talked about earlier in the class come out, they get deposited in your subcutaneous fat. And the far infrared sauna has a wavelength that penetrates, I can't remember, it's 1 or 2 centimeters into your skin, and it mobilizes those toxins, and you will sweat them out. Then you go take a shower and get rid of them. But it's a documented way of helping detoxify yourself. Coffee enemas. Yeah, people have to be pretty sick to give themselves coffee enemas, but they aren't too bad. There's worse things to think about. And chelation. There's natural chelators like chlorella, cilantro, blue-green algae, and you can also take EDTA. There's a variety of ways to take the chelation substance, EDTA. You can take it by pill. It's getting harder and harder for doctors to be allowed to give you intravenous EDTA, because the medical board now says it's unethical. I mean, it's ridiculous, but that's what they're doing. There's no science behind what they're doing. It's just their limited view. They're almost blind because they don't have all these good truths, right? Okay. But if you have a serious lead problem or a mercury problem, you can get chelation suppositories that are almost as effective, and there's much cheaper and easier than the IV chelations. Alternative therapies. Now these are things you won't read much about. Because most of us have some degree of autoimmunity, I think personally it's a good idea for most of us to consider taking naltrexone. Now, and here's the beauty of learning how to dowse or muscle test. Find out if what I'm telling you is something you personally need to do. Now, everybody doesn't need to take it. Let's say you need chelation, or you need turmeric, or you need naltrexone. You can dowse to see how much you need, how often. You might only need it in your situation. You might only need to take it once a month or once a week. So it isn't a big financial or burden or inconvenience. Find out what you, as an individual, in a certain set of circumstances, need to do. You might not even need it. Hydrogen peroxide, homeopathy, cortisone. These are things that will take a little study on your part, because the vast majority of doctors are not familiar with these therapies. They've been around for, how many of you, for example, how many of you have heard about the using Tagamet for cancer? Nobody. But this was written up 20 or 30 years ago. Now, why do you think you haven't heard about it? Come on, same answer for all these.
Money, there's more money in this country.
There's no patent on it. But you can get over the counter. If you get a case of herpes, shingles, Tagamet is wonderful. Super. What Tagamet does, see, in your body to help your immune system kind of regulate itself, here again, very simple, incomplete answer, but you have what they call T helper cells and T suppressor cells. Now, when these are out of balance for whatever reason, let's say you have just helper cells, very few suppressor cells, then your immune system is going to be going like crazy, and you're much more likely to have an autoimmune disease. But let's say you have very few helper cells, and a whole lot of, then your immune system is going to be suppressed. So if you have cancer, there's a good chance that your suppressor cells are going to be dominant because your body's not protecting itself. Tagamet gives you this helper cells, suppresses it. It's not hocus pocus, it's science. This is well documented, written up in the major medical magazine, Lancet. So it's not hocus pocus, but you don't hear about it. That's the whole purpose of what we're trying to do with this foundation, with this tax-exempt corporation. We're trying to get this information out there. So you don't have to rely on, I mean, if you have Barrett's esophagitis, you can drink urea. Okay. All sorts of good things. Okay. Hydrogen peroxide, the right amount. We didn't talk much about coconut oil, but coconut oil is another. If you have any sort of chronic condition, everybody should take coconut oil. It tastes good, it's not expensive, and it does 100 different things. Seems like every day I see 100 uses for coconut oil on the internet. Every day. And it does. It kills unhealthy bacteria and yeast and parasites in your gut, and we all have them. It leaves the healthy people, the healthy organisms alone. So it just does a lot of good things, and it's easy to use. We had potato soup yesterday. I put 2 or 3 tablespoons in the potato soup. No one even knew it was there. Did you guys know there's coconut oil in potato soup yesterday? Anyway, no one noticed it. I put it in my daughter's oatmeal this morning. She didn't notice it. No, you don't tell them these things. You just do it. They start talking about it, and then they make funny faces. Okay. Colchicine. Anyway, there's all sorts of good things you can add to your diet. And I can't leave any class without talking briefly about urine therapy. Another great way to help your immune system regulate itself. Fits all the criteria of good medicine, which is cheap, safe, and effective. We won't talk about the psychology of it. We'll skip over that right now. Okay. Then, okay, there's a whole new area, well, it's not brand new, but it's just come out with a little different approach, and that is what they call the gut and psychology syndrome. The doctors found this, there's several books written on it. If you Google that phrase, you'll get more information than you can probably handle. But it's a doctor's really done a lot of studying about the fact that psychologically how we function depends to a great extent about how gastrointestinally we function. And it's so critical that newborn babies get a good start by getting nursed exclusively. That is critical to long-term health. It's so critical. One doctor studied this. They're saying they know a baby's going to be born by a C-section. They say, okay, we'll put a tampon in the mother vagina for a week or so, or for 2 days. I can't remember that. For a few days before the baby's born. Then we'll take that tampon, and as soon as the baby's born through the tummy, we'll rub that baby down with that tampon, because that's what's supposed to happen when she's born. And that's the kind of stuff that's supposed to go in the baby's gut and then colonize the intestinal tract. But unfortunately, too often a C-section baby comes out through the tummy, they wipe all the stuff off, and then they put it in the nursery and give it corn syrup. One of the worst things you can do to a baby. But anyway, but it's interesting. But it's a whole new area. So if you get hyperactive kids, ADHD kids, PTSD people, just about this lady with anxiety and depression, she ought to get that book and read about it, because taking her Zoloft and Paxil and all this stuff's going to kill her. And probably your baby, too.
Well, one was on Lacidophilus probiotics. She had a colostomy. She'd had a C-section. And the pharmacy overrided her doctor. Her doctor ordered to continue her Lacidophilus probiotics. The pharmacy put a sticker on the doctor's orders page, this was 2 weeks ago, that they are discontinuing her probiotic because their policy is any supplements, herbal supplements, are unsafe. It's a safety factor. And she was on Zoloft.
I don't know if you hear that. A real life experience was a lady was in the hospital, the doctor ordered probiotics, the pharmacy overrode. That's almost, the pharmacists are usually pretty smart. But oftentimes we hear about the pharmacy overriding the doctor's order or the insurance company overriding the doctor's order, and because the reason they gave was because probiotics and herbs and vitamins are categorically unsafe. But you can take Zoloft, and you can, anyway, it drives you crazy.
They
And
continue her Zoloft.
a lot of these things you can't do anything about except maybe influence a few people and keep your fingers crossed. Anyway, it's a real challenge. It's very frustrating. You begin to understand what Ignaz Semmelweis experienced. When he knew that doctors were killing the mothers after their babies were born, he proved it, but the doctors ignored him, and he finally committed suicide by giving himself that childbed fever. But don't do that, please. Don't start taking Zoloft and Prozac and things like that. Okay, and if you need to beef up on your understanding about all the good things about coconut oil, here's a primer. You can get started here. You can learn, but get your coconut oil out of the refrigerator, out of the closet, get it onto the kitchen counter. You will not use it if it's in the closet. Well, you might, but not nearly as long. Put it, melt it with butter and put it on your popcorn. There's just 100. If you have soft-boiled eggs, do that. Just a little aside, my daughter's here visiting, and she was out wandering around our yard, and she found the eggs. That's always a big mystery at our house. Where are the chickens laying the eggs now? And she found 18 or 20 eggs in one big pile. Great. Big yellow yolks that stand up. Anyway, we're excited on it. But eat good food. And pick one or two of these things and get busy on it. If you have an autoimmune disease, or you know someone that does, give them the book. Don't try to explain it yourself. I mean, just give them the book. That way you won't offend anybody by trying to proselytize them into better lifestyle. Okay, well, any questions? You understand everything?
Eat well.
Eat well, digest well. That's the thing. Okay, well, great. Well, keep learning. Yeah, another good source. I'm going to try and incorporate some of the. Go to the Khan Academy, and under the science division there, you can get some real great little brief explanations about the immune system, the musculoskeletal system, the heart. He's wrong about autoimmune, and that's okay. For the most part, it's a good source. The person presenting that lecture said the immune system acts in a random fashion. Nothing our body does is random. It's done for a reason. How many years have we said, oh, that part of the body is not very important? And then we get a little smarter, we learn a new truth, and it opens up a whole new vista.
What was his name, you said?
K-A-H-N. K-H-A-N, I'm sorry. It was not K-H-A-N, it's K-A-H-N.
On what?
Academy.
Okay.
He tried to educate the whole world for nothing. But Bill Gates is now involved.
Uh-oh.
And that's, he's the nose of a camel. It's discouraging to see it, but if you have enough money, you wiggle your way in. Hard to resist $1 billion grant or whatever. I don't know. Okay. Stay away from that vaccination needle and keep reading.
There's some of us that are a little afraid about the pendulum, you know, because it's kind of spooky, I guess. Does that thing where you put it something against your chest?
Well, isn't that
you
kind of
get
spooky?
Well, it
Yeah,
is.
gee whiz,
Yeah,
I go
know,
back
but
and forth because I hold something on my
it's
chest.
not quite like witching for water, and you know.
I know. Well, you can
But
try
anyway,
it
does
that
that
way.
work? Very good.
Well,
I mean,
it works. A lot of people use it because they get spooked out by the pendulum.
Oh, okay. All right.
That-
Yeah.
uh,
Oh, I know. How come you aren't spooked out about your cell phone?
Well,
the voice
I
is
use
coming out of
that.
the air. I mean,
Yeah, I use that all the time.
you know, I know we do. It's just, see, you aren't familiar with it. As we get familiarity, helps us understand and become more comfortable with it. You just got to keep doing it. If you here's the problem. If you don't do that, what are you going to do? How are you going to make these decisions? You guess.
Yeah.
You just guess, and you think that's
Yeah.
okay. That's really spooky.
Really doesn't work too good.
Yeah.
Okay.